LauraLynn Childrens Hospice opened in 2011. It was brought about by the inspiration and determination of a lady called Jane McKenna, who sadly lost two daughters, Laura and Lynn. Before Vitro, we had a lot of documentation in LauraLynn. Certainly where you have that volume of variety and that volume of documentation, number one, it's very hard to collate it all. Number two, I would have concerns and did have concerns as to how well the different elements of a child's needs were being communicated amongst the multidisciplinary team.
We had issues around the basic things like legibility of handwriting, consistency, using multiple versions of different forms. We had documentation stored in lots of different locations. So if you're a clinician on the floor, you might have to walk between many different locations in order to just source a file. So the reason that we chose Vitro in particular, we had looked at different systems that were out there, but for us really, Vitro was the one that most closely matched our needs here in LauraLynn. For me, one of the big factors that we were looking for was something that was going to be user-friendly, and that was one of the biggest things.
So Vitro is a clinician-centric EMR that's bespoke to hospitals and adapts to the clinician's workflows and pathways within that hospital, fully integrated with all hospital systems.
So it's very important when we do the check-in with the staff here that they go through everything really diligently, and now it's just a matter of minutes. It's fantastic. On the new system, it's all up. If there's any medication changes, we'll just at a press of a button, it's changed.
The implementation of Vitro here took around 4 months, which was really, really fantastic for us.
It happened because the system itself was so easy to use and so user-friendly for the staff.
So I just received training in Vitro last week, and I think it's a testament to how easy this system is to use that it took an hour and a half for me to be trained in the entire system. It is going to be a huge benefit to the children who use our service. It allows us rapid access to their information and helps to streamline the care that we're going to give them.
Since it started now in the last 3 months, we've seen an improvement in the quality of information, as well as less duplication of information, so we're not recording things 3 and 4 times.
As a doctor with very typically bad handwriting, I think that anything that takes away paper and improves my legibility is a really good thing. It's great for patient safety and means that all healthcare professionals can read each other's notes and get a really good record of the care of the child as they move through the system.
It gives us an opportunity to use the system in the community. We have an outreach service here, a LauraLynn at Home team, who go out and deliver care to families in their homes in the community. We can now use Vitro in an offline mode where the nurses and carers will be able to upload the children's information, go out to the home, write in their notes, and then sync back into the system when they come back in and upload all of the information. So it saves that duplication where they would write information in the home, come back into LauraLynn and have to rewrite everything they had written. So that's a huge saving in time for them. Initially, when I tracked some data, we were seeing our admission times were improved by about up to maybe 16%. But now, several months down the line, we're seeing that as staff are becoming more familiar with the system, that our efficiencies are nearly halving the time. So it's really great for our families that it means that their admission process is so much faster.
I would say that this was a system that was the most readily adopted by the organisation. Project management, as in the support from Sláinte in the introduction of the Vitro system, was second to none. The team, as well as the team here in LauraLynn, worked so well together, and they were always accessible, always available, and were on site if needed as well.
They give him the utmost care, the medical side of things, 24 hours when he's here. We'd be lost without her, we really would.